Margaret Harris is spokesperson for the World Health Organization, and she's joining us from Geneva. Thank you very much for your time today, Ms. Harris. Is your organization still receiving humanitarian supplies, or has that stopped since Israel closed the Rafah crossing?
It's stopped completely since they closed the crossing. We're expecting to have fuel delivered today. We don't have it. So we've had to suspend some of our activities to the north because we want to reserve that fuel for the hospitals to ensure that they can continue their life-saving work. But that's not going to be possible for more than a couple of days. We will then completely run out.
Yeah, I think we heard from the Director General of the World Health Organization saying that you only have fuel for 3 days left. Is that correct?
That's right, 2 to 3 days, depending on how well it's managed, how you regulate the use of the fuel, because the main use of it is to keep the generators going so that the surgeries can be performed. But yeah, at best, it's 3 days.
And I understand that the WHO provides more than half of the fuel and medical supplies to Gaza's hospitals. So without you receiving those supplies to distribute, well, we know how much backup fuel you have for electricity, just 2 to 3 days. But what about how much backup medical supplies do hospitals currently have?
Not much. Now, we pre-positioned, knowing that this incursion was likely. We pre-positioned supplies at as many of the hospitals as we could, including the hospitals in Rafah themselves. But as you've heard, those hospitals under threat have had to evacuate their patients to other hospitals. We've also done things like set up dialysis units in the Nasser medical complex, which, as you know, was almost destroyed. But with our work with MSF and other agencies have been able to rehabilitate that, so that should open soon. And also we've been able to get things like dialysis units to the field hospitals. But these are tiny amounts. It's our representative has said it over and over again. It's a Band-Aid. It's a Band-Aid on what's looking like a hemorrhage right now.
Yeah, absolutely. I mean, what is the state of Gaza's hospitals at the moment in terms of how many are functioning and at what capacity?
Well, none of them are functioning at full capacity, and they haven't been functioning at full capacity for a long time due to loss of staff, lack of fuel, limited ability to limited food even, and damage to the actual hospitals. But again, we've certainly heard Al-Najjar had to close down. Now, that was the hospital providing all the dialysis services to people in kidney failure. And to put that in context, if you don't get dialysis when you're in kidney failure, you will die very quickly. That is what is keeping you going. And at least 700 people were dependent on that.
What happens to those people now? Do you know what's going to happen to those 700 people who need daily dialysis?
It horrifies me to think of what they are going to do. Now, as I said, we have provided dialysis units to some of the field hospitals, so the field hospitals will do their best. But those hospitals have a capacity of something like 45 to 50 beds. They're not huge. They can't be because they're tents. We've been able to add about 500 beds in the field hospitals. But the other thing is, how do they get there? How do the people get there? Your correspondent was just describing this river of people going to a barren strip and of terrified people, not sure what they're going to do. I just can't imagine how a desperately ill person is going to be able to even reach the care, even if it's available.
Yeah, desperately ill. Then there is, we know very well that half of Gaza's population are children. We know that there are a number of elderly and that there is now famine in northern Gaza. Does the WHO know how many people have already died from starvation and malnutrition? I understand that, Gaza didn't have medical professionals who could diagnose malnutrition before the war. So is it possible that people are dying from it without the diagnosis?
You're right, Elizabeth. In fact, malnutrition was not something that doctors in Gaza saw before this war. In fact, some of our training has been on how to identify it. Now, we have official figures from the Ministry of Health saying that 28 people have died of malnutrition, but those are people who reached the hospital. We have no idea of what's happening in all the makeshift shelters, all the overcrowded places. What we do know is we're seeing huge outbreaks of diarrheal diseases, respiratory diseases, hepatitis, all things that you get from being overcrowded and not having access to clean water. And in a malnourished child, that's a death sentence. And a normally healthy child would overcome it, but not a malnourished child.
Yeah, and Ms. Harris, given everything that you've said, what is your message to Israel and to anyone who has leverage with Israel about the situation in Gaza, about a ceasefire, and about the entry of humanitarian aid into the Strip?
For humanity's sake, please, ceasefire now. Get the hostages back. Their families have suffered so much as well. There is such appalling suffering. We as humans must not let this continue. Please, please have a ceasefire now.
That is Margaret Harris, the spokesperson for the World Health Organization, joining us. Geneva, thank you very much for your time.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.